Hey everybody, welcome back to the Outcomes Rocket. So excited that you tuned back in today. I have the privilege of hosting Dr. Ed Lee with us. He is the Chief Medical Officer at Nabla and is a primary care physician currently practicing as well with over 2 decades of healthcare technology expertise. I'm so excited to host him here on the Outcomes Rocket. Dr. Lee, thanks for joining us.
So thanks for having me.
It's our pleasure. And look, really excited to unpack the work you guys do at Nabla, but also wanted to learn more about you. So tell us a little bit about you and what inspired your work in healthcare.
Yeah, absolutely. So as you mentioned, I'm a practicing primary care physician. I trained in internal medicine at UC Davis Medical Center in Sacramento. And following my training, I joined Kaiser Permanente in the Permanente Medical Group, where I spent basically the next 20 years spearheading various transformative initiatives around informatics or healthcare technology and innovation, and enjoyed my time there. But recently, as you mentioned, joined Nabla as their chief medical officer. There are so many things that drive me to do the work that I do. Healthcare technology is fun. It's exciting. It's often cutting edge, although sometimes, quite honestly, it's not. Sometimes it's about using older technology and developing or improving processes that where the technology will make the biggest difference. And so that's sort of the fun part. And you can think of it as sort of a puzzle that requires imagination and creativity and knowledge and expertise to solve. But those are all kind of more personal fulfilling reasons. The bigger picture, the more meaningful and true inspiration around my work has always been for our patients, delivering high quality care, which all our patients want and they deserve. That's really at the center of it all. And sometimes it's creating technologies that patients will directly interface with. And other times it's developing tools that our physicians will use. I always say that when you help our patients, you help our physicians. But when you help the physicians, you also help the patients. And so there's a lot that ails the American health system, and including things like physician and nurse shortages and rising cost of care, inadequate resources, physician burnout. There's a lot to fix, but I'm a firm believer that technology, and more importantly, optimized technology, is one of the key levers that will assist us in mitigating many of these problems that I just mentioned.
Yeah, no, for sure. And I love the way you put it, Dr. Lee. If you help a patient, you help a physician, and vice versa. If you help a physician, you help a patient. Talk to us about Nabla. What are you guys doing to add value to the healthcare ecosystem?
Yeah, Nabla is the developer of Nabla Copilot, which is the leading AI documentation application in the industry. So more clinicians use Nabla than any other similar product out there, which speaks to the value that Nabla is bringing to healthcare. It's no secret that physicians and other clinicians have an overwhelming amount of work that needs to be done. And unfortunately, a lot of what they do now is administrative in nature. Studies have shown that for every hour of direct patient care, there's 2 hours of work that needs to be done in an electronic health record. And one of the tasks that takes the most time is writing notes, documenting the patient interaction in the EHR. So what ends up happening is that a physician will see a patient during the day, and it'll be an 8, 10, or 12-hour day of patient care. And the documentation work starts after the traditional workday ends, often extending well into the evening hours. So what Nabla does is that it dramatically and significantly reduces the documentation burden that clinicians face by listening to the conversation between the patient and the clinician and using AI through proprietary developed large language models to produce documentation for the clinician. It works in dozens of specialties, both in ambulatory and inpatient space, multiple languages with interpreters. When there are multiple people in the room speaking, such as when you have a pediatric patient with parents and siblings, all part of the conversation. And not only does it create the consultation or the progress note, it also writes patient instructions, which can create summaries that's written in patient-friendly language without the medical jargon that the patient can review after the visit. And in addition, Nabla can suggest ICD-10 codes for the visit, and soon it'll also recommend HCCs and CPT codes. Someone using Nabla can easily save 2 hours a day. And that's not theoretical. I've seen it happen in real life. I've had colleagues tell me that Nabla is a game changer for them. And I've seen testimonials saying it's saved their medical practice. They were considering retiring early, but because the work was unsustainable before, but now suddenly is sustainable with the use of Nabla.
Well, that's fantastic, and certainly leveraging large language models, big play today with Gen AI, and so talk to us about how it's different or better than other options out there today.
Well, we have a product that does all the basics of what you'd expect out of an AI scribe solution. Create a beautifully written note, well-organized note that contains all the pertinent facts from the patient-physician interaction. But what I think we do especially well is that we understand that writing a clinical note is personal. We all have our own way of documenting. And so with Nabla, we give our users the freedom to customize the note in the way that they want to. We've got numerous different templates that can shape the note in how the clinician wants their note to be shaped. We have this concept of verbal dot phrases where you can say key words during the visit, and then Nabla will expand those keywords into a block of text. We have the ability to regenerate the note if you want more detail in one section or less detail in another. And I think what that all boils down to is the fact that we're super customer focused. We understand that there are unique needs, and we want to shape the product so that it will exceed your expectations. And so these customizations all also happen at a pace at which you want, meaning you don't have to wait months or years for upgrades and technology to happen. They're really literally happening all the time. And I'll often have a suggestion of a new feature, and the next thing you know, next day, next week, it'll be available for me to use already. So it's really
awesome.
great in that respect.
Yeah, that speed, that innovative speed is key, especially with these types of tools. That personal element, I've definitely heard of it before, Dr. Lee. The sort of the ownership of the note, and I've never been a physician, but certainly have heard it before. So it sounds like a very valuable customization suite that you guys offer. From my perspective, actually this is a hot topic, right? So I'm chatting with my wife about it. And then she's like, so does it integrate into the EMR? So does it? Then does it do it automatically?
Yeah. Well, so there are different versions out there where you can have it sort of a standalone outside in a web-based application. And there is an ability to integrate the note directly into the EHR where you're using the tool and you click done, and the next thing you know, it shows up in the EHR.
Nice.
And so there are pros and cons of each. With the former, you can get that out deployed right away. There's nothing that needs to be done. Everyone has access to a web browser and a microphone, and you can use it today. With the integrated piece, you've got the convenience of having the note show up there, but you do have to put work in on the health system side to build that integration into the workflow. So
totally.
There's pros and cons of each.
Sure. Yeah, a heavy lift maybe up front, but then you get the benefits on the back end.
That's right.
For the integrated one. Yeah, no, fantastic. Thanks for sharing that. I'll be sure to share it with her later today. and of course, our listeners, for everybody, you could get it as an app, a web browser, or it could be integrated as well. With the creation of these types of tools, Dr. Lee, it doesn't happen without any issues or setbacks. What's been one of the biggest ones that's come up and a key learning that has made you guys better as a result?
Setbacks happen all the time in life and work in general. And I'm part of the Slack, Nabla Slack, and I see the different reports that come in. And the thing that's striking to me about what I see is that when something comes in, it gets fixed quickly. And that's kind of the last time I ever see anything mentioned about that particular issue. I think part of it is that the speed to execution part and being quick and nimble. But the other thing is that using setbacks as opportunities to take steps forward, learning from them, understanding what went wrong, making changes to prevent it from happening again, and knowing that the setbacks aren't necessarily what define you, but how you respond to them does. how you exhibit resilience and the strength that you have to overcome any setback that you have. And so problems that I see, I never hear them out again because the solutions are done rapidly, but in a thoughtful way that solves the problem now and into the future.
Yeah, for sure. It's not what happens to you, but how you respond. And I think it's great to know that you guys do respond fast. And how about, look, we're talking about a technology that is innovative. It is a trend. There's tons of buzz, right? So this question that I have for you is like basically what we've been talking about is tech or trends in healthcare. But maybe the other angle we could look at this one, Ed, is maybe how can people think? How can leaders think about these technologies differently? Like, what are you seeing, and how could they be thinking about them differently as they seek to adopt these types of technologies?
I mean, AI is such a big thing right now, and I'm not saying that just because it's a buzzword or because of all the hype that's around it. I mean, I'm saying it because I've worked with the underlying technology. I've deployed AI systems. I've seen what it can do when it's deployed at a large scale and how much value it can bring. But it needs to be done in a systematic, organized, and thoughtful way. That's how you can extract the most value out of AI. And when I say AI, I'm not just talking about the generative AI space in which Nabla is in, but AI in general. And I subscribe to the term augmented intelligence rather than just plain artificial intelligence, because I think it emphasizes that AI is not a standalone product, at least not in the clinical healthcare space, at least not yet. So using AI as a tool to assist and to complement the expertise of physicians and other clinicians is really actually how we're going to make the biggest difference. I see it making improvements in quality of care, elevating patient experiences, mitigating access challenges and physician shortages, decreasing overall cost of care because patients will be able to get care sooner, which means their health conditions are less likely to progress to more advanced stages. That means less morbidity, less mortality, less suffering, lower costs. So, in addition to the generative AI space, large language model space, I think, computer vision, where AI can detect visual patterns and sometimes can be difficult for the human eye to detect, and predictive analytics, where AI can look at millions or if not billions of data points and find patterns through there so we can understand what's more likely to happen in the future and again, intervene earlier.
Thank you so much for that, Dr. Lee. Very insightful frame of thought around AI and how we should be thinking about it. So folks, something to think about as you approach these opportunities in your particular health system, or if you're a technology seeking to help health systems or payers for that matter. It's certainly important. The thought that you put to it and the frame of thought that Dr. Lee shared is a really great one. Ed, this has been an incredible opportunity to chat with you. Really just appreciate your passion for the work that you guys do there. And so if you were to leave us all with a closing thought, what would that be? And what's the best place the listeners and viewers could learn more about you and Nabla?
Yeah, so first of all, thanks so much for having me on the podcast here at a great time. I think the future of what we'll be doing with AI scribe technology and AI in general, it's only going to be limited by our imagination. The potential is massive, but only if we deploy and employ technology in the right place at the right time. And, I'm confident that's going to happen. There are a lot of smart people out there in health tech with the goals and the visions that are aligned with, I think, what I think is most important, which is, again, sort of getting our patients the best care possible. So, the best way you reach me, probably on LinkedIn. You can find me at Ed Lee, MD, MPH.
Amazing. Thank you, Ed. Really appreciate that. Folks, in the show notes, you'll find links to ways to get in touch with Dr. Lee, as well as learn more about Nabla. And Dr. Lee, want to thank you for being with us today.
It's a pleasure. Thanks all.